October is National Children's Health Month, and my guest this morning here on Jersey Magazine is Dr. Fernando Ferrer, who was recently named Chief Pediatric Officer for RWJBarnabas Health. Dr. Ferrer, good morning. Before we actually get started on children's health and what have you, before you and I came on the air, you were telling me your musical preferences. Tell our listeners about that.
Oh, I'm a rock listener, man. Anything from classic rock up to, Foo Fighters, the stuff that you guys play. It's my preferred genre in the operating room, because it gets me pumped up, to do a good job for the kids I take care of. So yeah, I'm sort of old school that way.
So now, when you do that, when you have Pearl Jam or Guns N' Roses fired up in the operating room, what are some of the looks that you get from some of the other doctors who are with you?
It's a little bit age dependent, right? People that are of my generation, I think they like it. I think that some take a look at it and say, "Holy cow, this is really intense." But my response is, "Look, we got to get pumped up to do the right thing for these kids today, and this is the music that charges me up."
I mentioned to you before we came on that I've had a couple of catheter ablations, and during the procedure, they had WDHA playing, and I'm under sedation at that point, but I'm thinking, wait, this is pretty cool.
It's incredible, right? I love the fact that some of the kids today are still connected. I had this kid come into the operating room, and oftentimes, as they're going to sleep, we ask them what music they want to listen to. And this one young guy, maybe 12, 13, said Nirvana. And I was like, yeah, this is great.
Well, tell us about your role at RWJBarnabas Health.
Oh, thank you for having me on. Yeah. So I'm the Chief Pediatric Officer, Senior Vice President for Children's Health. I'm really excited about this. I'm from New Jersey originally, and the thought of being able to come back and contribute to children's healthcare in the state is really important to me. So basically, for me, in my role, what I do is I sort of set direction, strategy, decide what the care standards around quality and safety should be for kids in our large health system, and sort of try to plot what the future needs of care for children in the state are going to be and how we're going to address them. So it's really a privilege, for me to have this job. I'm really excited about it.
And what drew you to RWJBarnabas Health in particular?
Fundamentally, I'm an academic physician. Published a lot of papers, researched by the NIH. And when this merger between Rutgers Health and the Barnabas healthcare system happened, it really caught my attention because to be impactful, you need to have scale. Barnabas Healthcare, RWJ Barnabas system is huge, and coming together with Rutgers really gives us an opportunity to leverage that size to take good care of kids, train the next generation of physicians in large numbers, and also do really meaningful research because oftentimes you need certain numbers to have your research be relevant, statistically significant. And I saw the opportunity there and it made me really excited.
And what does RWJBarnabas Health, how do they approach delivering pediatric care at
So
such a high
here's
level?
Yeah, so here's the thing that made me really excited about RWJ. And I was talking to the CEO, and the entire time, all the conversation was about taking care of the needs of children. And the system is the largest provider of healthcare to the underserved in New Jersey. And I'm really a mission-driven guy. And quite frankly, that was really compelling to me. So the approach is basically to say, this is our population in New Jersey, regardless of demographic, and how are we going to address those populations' healthcare needs as close to home as we can, but also at the same time carefully looking at the really high complexity, high intensity care that kids need today, and how are we going to get to a place where we're delivering that in the best way possible. So that's the approach.
And this state is so diverse. You mentioned growing up here in New Jersey, and from where you grew up, and I grew up, now living in Morris County. You go 15 miles in one direction, you're in a major city. You go 15 miles in the other direction, and you're in a really rural area. I can't get over sometimes just how diverse this state is.
It's incredible. And, the funny thing about it is I've had the opportunity to travel a lot in the United States because of my academic roles and so on and so forth. And people don't get New Jersey. They just don't get New Jersey. They don't understand the diversity, the population, ethnic diversity. They don't understand the difference where you can be in a totally rural area out on a horse farm, and then the next minute in a feeling of a really urban setting. The state really has it all. My kids grew up going to the beach at the Jersey Shore, and I love the fact that my daughter considers herself a Jersey girl, right? A Jersey Shore girl. So I was so psyched when they redid the airport in Newark, and I saw the Rutgers sign, and I saw the Jersey Shore themes, because I want the world that travels through that airport to know there's a lot about Jersey people don't know. It's a great place.
Given the diversity that you just mentioned, how difficult is it to provide equitable health care to children across the state?
It's not easy. It's not easy. We have a lot of programs, and we're talking about a lot more programs to address those kids in urban areas, or those kids that might not have a specialty center close to them. Telemedicine can help, but obviously there are challenges sometimes with access to telemedicine. If you don't have the internet access or the computer access, we're spending a lot of time focusing on getting care closer to home. I just was looking at one of our programs that's just remarkable. It's an asthma program. And you think asthma is all under control. Well, it's not. In urban environments, it's very challenging. I was thrilled about this presentation about how we're not only telling the parents what to do and how to help their child, but tracking to make sure that they're getting the care, they're being compliant, to make sure that that child does well. And that's really a holistic approach, right? Not just here you go, do this, but following through to make sure that the child gets the care. So it's kind of programs like that that we're trying to develop to address, the inequities in healthcare.
And I know that there was a report that just came out in U.S. World News. Tell us about that.
Yeah. So, are you talking about the rankings?
Yes.
Yeah. So there, the system has a huge vision for pediatric healthcare, and in the most recent rankings that were fully published, we're very proud to say that two of our specialties were ranked amongst the best in the United States. On U.S. News. We also got some very high rankings from one of our some of our other programs in Newsweek. But that tells you a little bit about what our aspirations are. Um, the aspirations really stem around being the best, not just the best in Jersey, but just being the best. And that's what the state should drive for. We're a powerhouse.
I know this is a really generic question, but with October being National Children's Health Month, what kind of advice do you have for parents to help them keep their kids healthy these days?
Yeah. Getting your kid to the regular pediatrics appointments is really important, because the pediatric appointments where your child's growth and development are being monitored, and if there's some things that are sort of out of alignment, they could be addressed there. Um, the other thing that I would say is vaccination's a hot topic today, right? I don't have an agenda on this other than the kids' well-being. And the bottom line is vaccinations work. And we are seeing in parts of the world now where vaccinations haven't been available, the resurgence of these diseases. I was listening to a grand rounds by a really nationally recognized figure in infectious disease in Texas, where they have a lot of people that don't vaccinate. And, the reality is that we are seeing surges. He was pointing out that his research at, national, international level is showing that there are surges in some of these diseases that we thought that we had eradicated. So diet, really important. make sure that you're giving your kid lots of fruits, vegetables, and grains, and really encourage a lot of physical activity. No secret, obesity is a national healthcare problem at this point in time. And it is, if I had to say one thing that you can do early on that impacts the whole trajectory is the nutrition, balanced diet, obesity thing. That sets the stage for the rest of your life. It's a year upon year cumulative effect. So I think that it's a great time this month to focus on those things. And we're here to help. Call us.
October is National Children's Health Month. Dr. Fernando Ferrer, the Chief Pediatric Officer for RWJBarnabas Health. Thank you so much for your time this morning here on Jersey Magazine.
Thank you for having me on, and I'll be listening.